Good afternoon, Facebook land. I am Jennifer Pillow White with Acupuncture and Integrative Medicine, your friendly neighborhood craniosacral therapist. Today is, what day is today? Today is Tuesday, May the 26th. I hope everyone had a wonderful Thanksgiving. Whew, it's been quarantined too long. Wonderful Memorial Day. Remembering all those that we've lost. So I hope that everyone was safe and happy. Hopefully not too many sunburns because it was a glorious weekend. It was beautiful outdoors. So let's see here. What we're going to talk about today is about craniosacral therapy and how we can help with our children, specifically infants and newborns. One of the directions of my practice in the recent years has been going much more towards pediatric care. And I have really loved that shift in my career and in my practice. It's been fantastic. And so what I would love to talk about is a little bit how and why we use craniosacral therapy or some of the other associated practices with our children. You know, because our children, our babies are perfect, right? Yes, they are perfect. However, there can be some challenges that happen with little babies on occasion, and that has a lot to do with the fact that, you know, life is hard, all right? So babies, when they're born, you know, newborns, they're ooey gooey, perfect, elastic, and awesome, and fabulous. But the whole process of labor, you know, even in the most traditional sense, can be very, very challenging. And so one of the things that, you know, can happen is there can be some, you know, some slight stretching, there can be some compression, there can be some type of issue that happens within the first seconds of life. And that's under totally normal, you know, circumstances. Nothing has, you know, nothing negligent or, you know, malpractice has happened. It's just the baby's got to get born. Now, under other circumstances, you know, things happen and they happen quickly. And so maybe a birth might happen a little quicker than anticipated. And it's so the baby's like forced into this world, which again, completely normal and circumstances, however, may not necessarily be what we would expect, right? And so when things happen quickly and forcefully, it can be a little bit more challenging on the baby, definitely. Let's see here. Hi, Hannah. So then what can happen is the strains can happen within the first few seconds, and babies are really, first of all, good at babies and children are really good at kind of rolling with it, you know, and many times, you know, babies and children will be able to kind of heal themselves right then and there and such, and no problems. But also what can happen is some of those strains might be left. And babies don't obviously have the language to tell us that something is awry or something is bothering them. The way that they tell us is through fussiness, through difficulty sleeping, through reflux, through you know, kind of failure to to go through the developmental stages as quickly as we would expect. And so that's really where craniosacral can come in and really help be very helpful in those early days of life, because first of all, craniosacral therapy is very gentle. There's, you know, no force with it. And, you know, even with my adult clients, you know, the amount of pressure that I use is really 5 grams or less. That's the weight of a nickel. Babies, it's less than 1 gram. I mean, it's so very light. And so, you know, we address some of the restrictions that we feel right then and there, and then the baby continues to roll with it and thrive. Many of the things I see in practice, you know, where parents bring their children to me are because they have either word of mouth, first of all, or their lactation consultants or their pediatric dentists or whatever have suggested the care. And a lot of things that I see in practice are definitely, you know, colicky babies, you know, where they have the witching hour, usually about, you know, anywhere between 5 to 8 to 10 p.m., where they are just completely inconsolable. That scenario can happen and pretty commonly, and many times we chalk it up to gas. And the only reason we say this is because we don't know. It could be digestive woes. It could also be some restrictions going on in their neck or in their body, really. So we don't know. What we can also have happen, so I see a lot of with colic. Sometimes I'll see babies because they have pretty significant reflux, or they'll be arching their back, or they're some projectile spit up and such. So Cranio can be really helpful for those kind of scenarios as well. Also, if the baby is limited in how quickly they're rolling over or such, that can be helpful as well. Let's see here. One of the specialty scenarios that I've seen in practice has been that with the rise in awareness for tongue or lip tie, we will see, we're hearing about it more and more in media, and some people even question whether or not that it's becoming, we're making more of it than what it really is. Like, how is it all of a sudden becoming so much more than it was in decades past? It's really not. It's just our awareness to it is greater. What a tongue tie or a lip tie really is that the strip of tissue underneath the tongue that attaches us to the floor of the mouth is denser or longer in some of these children, or some of us adults, than we really expect, and that should be. And so what it does is it immobilizes the tongue. The same thing can happen where the lip attaches to the gum line or to the lower gum line, and also makes it a little less mobile. And that's a big deal for babies because, when they're going to suckle, especially breastfeeding, it does make it more difficult for them to feed. And the reason why we're seeing it more now is, again, not because it's, there's a higher boom in the production, population of this. It's more that it is rising because of our awareness and the awareness to breastfeed. For many, many years, centuries before, when midwives would help to deliver babies, they would recognize it and they would actually snip a little layer of tissue right there at birth. It's kind of not necessarily the most clean way of thinking of it now, but what they do is they would keep a really long, sharp fingernail and they would slice it right then and there. And then the baby would latch instantly to do breastfeeding. And that happened for a very, very long time. And then, in about the 60s and 70s, it became less in vogue to do breastfeeding. We were starting to be told that the bottle is best, that they would get better nutrition through formula. And so many mothers would, ease away from breastfeeding and actually use bottles. Bottles are easy to feed from. And so even if a child had a tongue tie, they would not have the complaints that they would, have because the bottle was fine. It didn't cause any problems. And so now we're moving back to breastfeeding more, in the last probably 10, 20 years or so. And now we're starting to have mothers breastfeeding and finding that it's painful. The baby isn't, the baby's not, fully draining the breast. The baby is fussy. The baby's got a lot of, gas. He's got a lot of spit up because they're swallowing more air. There's all these troubles. Well, now that there's a class of practitioners that are now treating the tongue ties or lip ties with a quick laser procedure that is very quick, heals quick, works pretty darn well now. And then many of these practitioners will then also realize that craniosacral therapy can be helpful after the fact to help loosen up the mouth a little bit better so it better feeding. So that is one of the little niches that I've gotten into, is working with a lot of these children and a lot of these providers, to try to help moms and babies to thrive. All right. So I love the work. Babies it's wonderful. I always thank my parents for trusting me to bring their babies to me. Let's see here. The last little piece I want to share with you is what can you do for your infants and babies. First of all, getting craniosacral therapies for your baby in your newborn, your infant, or your children is sublime, because again, it helps to reduce their nervous system and kind of create a calmer child. And if calmer child means that really all the wonderful digestive and processes in their body will happen much more easily. I also recommend that my clients, the parents, get craniosacral therapy because babies mirror their parents. So if mom or dad or other caregivers are stressed to the max or have other type of restrictions, then the baby will commonly mirror them. So you can go ahead and treat the child, but if you're not addressing a piece of this, which is related to the parent in this scenario or this example, the issue will continue. So that's another one thing I recommend. And then the other piece is really tummy time. Tummy time is a fantastic tool that us parents have for our children, and that is to encourage them to be tummy down. In the 90s, we switched to a pattern of sleeping, which was back is best. And what it was focused on was not having the baby laying on their belly down, as many of us did in generations past. Many of us slept belly down, and by doing that, it was typical and normal. But they were wondering if there was some relationship to SIDS, the sudden infant death syndrome. And so in the 90s, when they started switching to back sleeping for babies, they found that SIDS reduced quite a bit. There's still some other factors to it we don't understand truly, but they found that by bringing, doing back sleeping solely, that it really helped. But then what happened is we're finding babies with some misshapen heads because all they're doing is laying on their back and not changing the pressure points on their skull. We're seeing babies with torticollis, which is with wry neck, more than years, prior to the back is best movement. And then we're also finding babies having some issues with, kind of core strength. And so core strength or switching off of some neonatal reflexes to continue to develop. And where a lot of these reflexes or these neonatal or early childhood reflexes come into play is that their whole goal is about getting the baby to suckle to the mom. But that's about it. It's not, some of these reflexes need to actually be turned off like a light switch, in a sense, in our nervous system to allow the next stages to progress, which is to have better trunk control, to aid in sitting up, to eventually being able to stretch outward and be able to crawl, and then to walk, and to speak, and to do all these different things that come with the different stages of childhood. So when we were tummy down prior to the 90s movement, these reflexes would get turned off because much of that comes from tactile pressure to the abdomen, into the face, into the neck. And so since we have our babies laying back down, laying face up, they're not getting the stimulation to the front of their core that we need. And so some of these reflexes are not turning off when they need to. And if they don't turn off, the next stages of development don't turn on, or they're delayed, right? So doing tummy time is a big piece in regards to turn off some of those early reflexes and to allow the older reflexes to kind of kick in, as well as to elongate them and get better strength in their trunk. Now, who's going to help me? Last week my babies helped me, but my babies are much bigger now. So today we're going to have baby Jenna help me. Okay, baby Jenna is going to show us a little bit what to do at tummy time. Now, tummy time, most moms and parents say their kid hates it. They don't like it at all right? And I always say no child loves it, all right? They love to be on mom or dad or, somebody. The way you can do tummy time is not just by putting them on the floor. First of all, putting them on the floor solo is boring to them. If you're going to put them on the floor belly down, you need to be there right with them to make it entertaining, and talking with them and such like that. And you're only looking at doing tummy time for short bursts, especially in newborns, 5 minutes, but multiple times a day. So you could do that. Another way is the easy way. Basically, tummy to tummy, having them against you, laying there resting and them napping on you. That's fine. That's giving them the sensation that they need to the front of their belly. All right. So we can do that. The other piece we can do is going on our lap. So having baby Jenna laying across our lap like so gives her the stimulation. Also, we can do a little light, movement, which can help. That's another version. Doing carriers, having our baby against us while our arms are free and we're doing stuff, that counts. Another way you can do it is with a TheraBall. So I don't know if you all have a ball at home or such, but it's a great tool to use for our babies, where you can have them tummy down and you would sit on the floor with them and you are going to help roll them and play and do all these different silly things with them that can be just different. Holding on to them the whole time, please, people. All right? So that's an option. And then when they get older, the TheraBall is also fun. When they start having trunk control, being able to do things like this, where you're going to have them sitting and you're holding onto their hips, jostling them, that's fun. Kind of rotating it from side to side a little bit allows them to kind of have to create some strength in their trunk in order to hold on. All right? So those are your other options. And then one of my last and favorite ones is one of the things I did with the children, and I still do it today, even though they're 7 years old, because now it's fun. And that is what we call the mama ride. It's basically using your legs as the belly, the tummy time area. So I'm going to have my knees flexed, my hips flexed. I'm laying flat on the ground. I'm holding my baby. And what I'm doing is I'm pulling my knees closer to my chest, going away, coming closer to my chest, and they're looking at me, right? And by doing that, that gives them the freedom and the strength, to move their neck and get better strengthening of this area, as well as it's just fun to look at each other, and it feels really good on our backs. My children are 7 years old, 50 pounds apiece. They still try to climb on my legs and go for a mama ride. Yeah, it's a good workout, I can tell you that. Anyways, so that's going to cover my recommendations for using craniosacral therapy for infants and newborns. It is absolutely a wonderful thing to look into. The nice thing about babies is that they get past their stuff quick. They're perfect, right? So if they do have some restrictions or some type of issues, usually craniosacral therapy is recommended for just a couple sessions, and then they're off. They fly free, and it can be really helpful. And again, a happy baby makes for a happy mom or dad, and happy mom and dad makes for a happy baby. So thank you so much. I look forward to seeing you guys again soon. You be marvelous, be healthy, and cuddle your babies. Peace.